You're about to watch such an incredible conversation that I had the pleasure of having with one of my favorite physicians in our elite practitioner program. It is Dr. John Whitcomb, and he has a thriving practice out of Wisconsin. And I keep telling this to my Wisconsin doctors. We have a lot of Wisconsin doctors out of any other state. I feel like we have Wisconsin is one of our top states, and there's a common denominator there, and that is they all heard from us through Dr. John Whitcomb. And I gotta say, there's something in the water over there, or there's something in the air, or maybe it's high mold because all of our Wisconsin doctors come from this specialization of a mold practice, Lyme, Crohn's, these things that cause these mold issues that cause this chronic inflammation. And they've gotten so incredibly skilled at treating their patients that are constantly being told that nothing is wrong with them. Just allowing that to sink in a little bit, right? Imagine how frustrating that must be as a patient to be going from doctor to doctor and just be told that your brain fog doesn't, it's just part of you. That's your life when you know that's not the case. I think we're seeing that a lot with long COVID. I think we're seeing a lot with just brain fog in general, and we have these incredible doctors who are just doing such amazing groundwork. They are truly, I think, at the cusp of change, and the stories that we hear from them is truly remarkable. And I think it might be the missing piece in this whole puzzle of health. We get to see the rare side, right? The Dr. Goodnow's lectures, the science, the research driven sides of why he's doing these things. And that, to be honest, is a very rare sight because we don't really get to have that kind of conversation outside of reading a medical journal. We don't ever get to talk to these scientists, these professors, these incredibly, intellectual researchers. But we get that with Dr. Goodnow. And then now, when we're connecting that piece with what it looks like clinically, that might be helpful to some. And that's why we are having these conversations, is because we're getting such incredible research driven data from Dr. Goodnow. Now, how can we connect that to you and I? And it has to be through our doctors who understand that research better than we can because they had that formal medical training. But yes, the way that he explains things, very complex things, and we have a lot of our elite practitioners who do this really well. But the way he explains it is it takes these very difficult. He doesn't shy away from using all the acronyms, and you'll see that in this conversation. But he's also not dumbing anything down for you. He's just speaking about it in a way that you will understand. Oh, it's beautiful. Anyway, I hope you enjoy this conversation as much as I had having it. If you have any questions, we're here for you. Please email info@prodrome.com. Otherwise, please enjoy. Please continue. You were
Well, I
saying,
said, Dan Goodnow and I are joined at the hip in that we both believe people should be well and they want to see physicians who keep them well. And unfortunately, in America, we have a healthcare system that profits off of your sickness. And that's not really what you wanted. You certainly wanted your sickness to be addressed, but you really wanted to be optimally well. And that's just a whole different way of looking at things. And so, my fondest wish is to teach you how to care for yourself so that I never see you again. And they all laugh at that because they get the joke. And I said, it's much more lucrative to see you every 3 months for the rest of your life and never fix you. And that's just the wrong business model. I'm not in that business model. I don't want to see you frequently. I
mm-hmm,
want you to know that I'm here for you and
mm-hmm,
to keep you well. Well, that's not that hard a concept. And that's what clients want.
mm-hmm,
But they need now, they have an illness. And we now have a methodology of Dan's graphs, those two graphs he have of how long you live based on plasmalogen level. and risk of autism based on plasmalogen level, or a risk of dementia based on plasmalogen level. Those two graphs are mind-bogglingly important graphs because I show the one about how long you lived at all my clients, and I say, this graph could not be true if it didn't have a massive impact on heart disease and cancer and autoimmune diseases. And I said, so we're talking about cholesterol for heart disease, and that's just nonsense. Plasmalogens are the core problem of heart disease, but they're also the core problem. So I just saw a guy yesterday who is so wealthy he can fly to Boston to see the best prostate guy in the world and then chase him, go down to MD Anderson to see him when he moved down to MD Anderson because he has prostate cancer. And then he flew down to Florida to a guy who put him under deep anesthesia and heated his body up to 106 for 1 hour because he's killed every cancer ever since then. That's how wealthy he is. And that's how smart he is that he's willing to chase that down. Okay. He comes to see me yesterday and says, okay, now how do I make sure this cancer never comes back? And I show him Dan's graph about your risk of cancer based on plasmalogen levels and how cancer starts with some oxidizing stress that depletes depletes plasmalogens, and then your mitochondria start becoming weird and start exporting citrate and accumulating cholesterol. So I went through his protocol of cancer, and I said, which of these are you willing to do?
Mm-hmm.
Well, he's already on 5 and 5. And I said, you need to raise your plasmalogens up to 15 and 15. And so he's going to we went through the whole cancer protocol and we wrote prescriptions for everything on the cancer protocol, even though he doesn't have cancer.
Wow.
But he had his prostate taken out and he's had a PSA of 0.1 and he's now 70 years old and he never wants to get cancer. Well, that's it. So that's one example of
Wow.
now that's a wealthy person who can afford it.
Mm-hmm.
But I have another guy who comes to me with multiple myeloma who's worried about his dementia. And so we start him on plasmalogens for his dementia. Okay? The problem with multiple myeloma is our modern chemotherapy is pretty effective. So folks are living longer. As they live longer, those high proteins in their blood tend to kill off their kidneys and they end up on dialysis to add insult to injury. So a lot of multiple myeloma patients end up on dialysis. He brings in a graph to show me. And the graph shows he drops off a urine at the oncology clinic every week to be tested for amount of albumin that he's peeing out every day. Or every 2 weeks. And the graph goes 390, 310, 250, 190, 110, 70, 50. And he says, I'm at the renal clinic and the nephrologist looked at me and says, I've been doing this for 35 years. I've never seen this happen before. What are you doing? And he said he was so confrontative. I was sort of worried, like, what was he mad at me for? I said, did you tell him you're on plasmalogens? He says, no. But there's another discovery. That's a potential publishable study.
Wow.
And those kind of things are going on. And so once the doctors who are in our practice start to hear those kind of stories, they will get the bug of it's time for you to start experimenting and seeing how this works.
So you mentioned earlier that you test for HLA, which is part of the Shoemaker protocol, and I've never heard of this. Would you explain the HLA for those like me who have never heard that?
The HLA haplotype, this is Shoemaker's biggest discovery, and I think it's brilliant. Every cell in your body has proteins on the surface of it that identify you as you. So John Whitcomb has his HLAs on every cell, all 30 trillion of them. And there's probably, I don't know how many there are on each person, there are probably 100,000 on each cell. But they are what your immune system learns on day one of when you're born, that's you, and you recognize you. It's proteins, you get 3 from mom and 3 from dad, and they come as numbers. And there's 55 known ones or so, but there's probably more that we just haven't discovered yet, but there's 55 common ones. That's what you do when you get tissue typing to get a kidney transplant,
Ah,
heart transplant. So that's the exact same test. What Shoemaker found was that there are 11 haplotypes that represent 25% of the population who are vulnerable to getting mold-related illness or long COVID or chronic Lyme disease or there's probably 20 or 30 things that cause it that are less common. But moldy homes and water damaged buildings is probably the most common.
mm-hmm.
And their most common symptom is fatigue and brain fog. But Shoemaker has its own list of like 35 symptoms. And I go down that list of people and they realize there are these 35 subjective symptoms that they have been accused of malingering when they say all their symptoms. So they don't tell people that. And they're so relieved to have somebody ask them about those weird symptoms.
Yeah.
And there are 4 of the 11 haplotype types, there are 4 that are ultra vulnerable.
Mm.
And those 4 represent only 2% of the population, but they represent 50% of people who see a doctor for SIRS. They're the ones who are really sick. They're the ones who are really they're quite symptomatic. And I'm quite fond of those 4 because my family is full of them.
Mm.
I mean, I live in a family of 4 353s, which we all have it. And so my kids have it, my grandchildren have it, and we're all asymptomatic on plasmalogens.
Wow. Were you
And
symptomatic before plasmalogens?
yes, I followed Shoemaker's pathway perfectly, and Holly got about 50% better, and that made her life much less miserable. I spent $100,000 cleaning up my house. Holly was on all sorts of, she was on all sorts of VIP spray and binding agents. And we started on plasmalogens, and bit by bit, all those other things just faded away. And now she's just taking the plasmalogens.
Wow.
So she's not taking any of those other things anymore.
Wow.
And so I got into it because my family was involved in it. So I was curious, and we went through the experience of going to multiple doctors and being told there's nothing wrong with you.
Jeez.
And I said, no, that just isn't the right answer. And I had to find it for myself. And actually, one of my slightly crazy, obnoxious, weird patients was the one who said, I think you should seek Dr. Shoemaker about mold. I think your wife has mold from what you're describing. And she was exactly right. It's always the clue always comes from left field where you weren't expecting it to come from. So if you don't listen to your patients, you're not going to get it. So you have to be open. You have to be open to being wrong and changing course and trying something different. And so I hope I do that with humility. I'm embarrassed when I don't. But those are huge numbers. Those 2%, those folks with mold and SIRS represent a huge amount of patients who are frustrated with the healthcare system because they don't have anybody acknowledge and understand their symptoms. So I think that's a huge business opportunity for us. And I'm deeply disappointed that Shoemaker isn't more receptive to it. But did you notice up in Moose Jaw we had a couple of Shoemaker doctors up there.
Oh yeah.
Every meeting we're having a few more,
Oh yeah.
you know. And so bit by bit, I think, and what they discover is, oh my gosh, my practice just got completely revolutionized. And then they'll realize, oh yeah, I get them better and they don't need to come back and see me. So now I need to see more patients. I have to find new patients, which is wonderful. That's what you want to have happen. You want to have success in your practice. The old Chinese proverb, you can always tell when we went to China, I was told when we were in our trip to China that there was an adage, the Chinese adage, that you can tell a good doctor because they have an empty waiting room, because their patients are well. And a bad doctor's got a full waiting room, which is opposite to what we say in America. So I went to a calligrapher in Beijing, and he wrote me that out in calligraphy, and I have it in my office.
Oh my gosh.
And I've had two American clients who are Chinese who can read Mandarin calligraphy, and they come in and they look at it and then they break out laughing and they say, I think I know what you're trying to say, but the guy sort of took liberties what you were. He says, yeah, that's an old proverb, but the guy didn't say the old proverb. He kind of wrote it a little, I don't know what he was
Oh
saying.
my gosh, that's hilarious.
But the whole premise is a
Yeah.
good doctor has an empty waiting room.
And this is why you have such a thriving practice. Now, can you tell me about any kind of defining moment way back in the past when you decided to change your practice to this focus, this plasmalogen focus? Was there a defining moment or several or a case that made you actually make that switch? Because it's a huge switch.
It's a huge switch, and it takes a while to learn it. You have to, in part, do it for yourself,
Mm.
and you have to, participate in it.
Mhm.
And in my case, my family was vulnerable and was sick. Uh, but I have multiple family members who benefited from multiple different ways.
Mm.
I have a 94-year-old brother-in-law whose Alzheimer's was starting to get out of control. He got lost in his own neighborhood.
Mm.
This is now 4 years later. He's been on plasmalogens for 3 years. He
Wow.
just went to my house for dinner over Labor Day. Now he hasn't recovered back to full functionality, but he's capable of recognizing us and laughing with jokes with us. But and he had an out of hospital cardiac arrest 6 months ago. I've talked to about 15 emergency doctors since then, and I've never seen an out of hospital cardiac arrest survive over age 90. He not only had the cardiac arrest, but he survived it and has no signs of damage,
Mm.
except for he's older.
Mm.
But he's back home. He didn't have a stroke. He didn't end up in a nursing home. He went back home. He's still alive because the heart attack happened partially because he hadn't gotten on plasmalogen soon enough. So many members of my family have been involved in. I have a nephew with ADHD whose ADHD is almost completely gone. I have a wife who's gotten better. I personally feel like my thinking has gotten better. I can feel like my memory's improved.
Absolutely. I mean, you're not slowing down. You're about to write your third book.
Right. I'm having fun writing books. And I'm not perfect. I still make mistakes. I still have, I can feel cognitive issues still with me that I want to get better. I'm still
Yeah.
looking for that to improve.
Yeah.
But no, when you say is there one day, no, it's a journey of seeing it happen in your own practice with patients who would benefit from it.
Mm.
But virtually 100%. Patients come to me because I'm an anti-aging practice. And my first job is to tell people, if you look at the arc of your life, when you're 55, 60 years old, looking at the next 25 years is a daunting thought because you've never been here before. And navigating that geography is a daunting thought. And for the next, 15 years, heart disease and cancer are what's going to do you. But if you make it to age 80, I tell everybody, if you make it to age 80, the needle flips and you'll die of a brain disease. And who wants to live to be 80 if you have a brain disease?
Mhm.
And so planning for your life out, as you plan your life out, you have to say, what can I do to make those risks go away so I can live to be into my 90s and still be functioning and having a functioning brain? And the way to plan that out is I have to start doing some things that I can help my brain get there. And
Yeah.
so that's what captures many people who are otherwise functioning fairly well, but they're a little bit anxious about the fact that when they get anxious, they'll forget stuff. They can't remember the name of that restaurant if they get anxious. They get anxious and nervous, they'll remember that restaurant easily. Say, oh yeah, we went to Caprese. That was a great place. But if they get anxious, they can't remember that name. And they go, oh yeah, so I need to be on plasmalogen. So that captures their anxiety and says, well, that's what you need to work on. And I don't know how to build up that infrastructure except to say that there's core information you need to have. And people in an aging practice need to all know some core information. For example, in JAMA 2 years ago in July, the 650 people who had an MRI done every year, a volumetric MRI done, that showed that their brains are shrinking at a
Mhm.
0.5% a year.
Oof.
And I say when you get to 70, it speeds up and goes a little faster, 0.5, 0.6%. And so it's happening to all of us. It's happening to you. We can prove it. And if you want to stop that shrinkage, you need to be on probably at least what mother's breast milk has in it,
Mm.
which is 30 milligrams per kilo per day of plasmalogens. How much do you weigh? Here's 30 milligrams. Yeah, it'll cost $600, $800 a month. That sounds expensive, but it's cheaper than a memory unit. And 1 year of plasmalogens is less than 1 month of memory unit cost.
Absolutely.
I said, so as you plan ahead and think through your life and you think through your retirement years and you think through your risks, you need to put all those pieces together to see how does that make sense to you? Does that?
Absolutely, it does. And you hit upon so many points. Like the price point is always a challenge, I know. But you're talking about things that make sense to even me, who's not yet in the senior citizen age, but I've seen grandparents suffer from these age-related diseases, from stroke, from heart issues. And I just look back and I wonder, oh my gosh, if I knew about plasmalogens then, what if they were still around?
Right.
Right, and not only just still around, you don't want to be just bedridden, you want to be functional, you still want to be, hanging out with them and being a family together. And so
Yeah.
that I think is so easy. It's easy to brush off if you're not dealing with it, but for the people dealing with it means I think a whole lot more.
Well, my mother died of Alzheimer's,
Hmm.
and she was in a memory care unit over in Madison. And I took Friday off every week to go be with her
Hmm.
so that my sister had a day off because my sister would see her every other day. Well, every time I saw her, she'd say, isn't there something you can do for me? And science wasn't there yet. Science wasn't there. It came along 8 years, 10 years too late.
Yeah, that's
And
heartbreaking.
many people are seeing their frail elderly and they say, I don't want that to happen to me.
Yes.
And that's why a lot of my patients come to me because they say, this happened to my dad, and it happened to my uncle and my grandfather, and it's my whole family's full of Alzheimer's, and so I don't want to get into it. And I say, well, we can help them. The good news is it's completely preventable. You can now engineer and plot out your life risks and do something about it. And we can show you how to do it. And you can navigate it safely
And prevent it
and just prevent it.
and to stop it from happening. Oh, that is so incredible. Okay, so then going back to this HLA, it sounds like it's a blood test. Is
Yeah.
that
If
correct?
you go if you go to lifeextension.com,
Uh-huh.
log into lifeextension.com, America's largest supplement company. And on the menu bar at the top, type in HLA-DR. In the script, I tell everybody it's $265.
Uh-huh.
I said, if I order this and you take it to our local hospital, to your local hospital, they will send it to LabCorp, just like Life Extension has a contract with LabCorp.
Uh-huh.
So LabCorp does all their lab. If you go to your local hospital, they will also send it to LabCorp, but they will take the $250 charge that LabCorp charges them, multiply it by 6, and charge you $1,500.
Oh,
And you will be cross with me because it will then be denied because you aren't having a kidney transplant. Your insurance only covers disease. It doesn't cover risk management.
oh wow.
So if you pay for it yourself with cash, you're getting a $1,500 discount. So I know it sounds expensive, but pay for it and get it yourself.
Yeah.
And if you haven't had fibromyalgia and chronic fatigue syndrome and all the stuff of, you'll come up with a normal haplotype.
Ah,
So you'll be one of the 75% who ends up being, no big deal.
no big deal.
And I tell people there's a wonderful website called biotoxinjourney.com
Mm-hmm.
that a lawyer has written up, and he has a nice pull down menu where you can look up under his lab tests, deciphering the HLA-DR, and you can actually look it up on there and actually interpret what those numbers mean.
Mm.
A whole bunch of my clients have done that on their own already. Many of my clients are smart people and have figured these things out and have been exploring. They just can't find anybody to help them.
Wow.
And so I think there's a huge unmet need, and our doctors should be able to get into that need. And particularly when the autism thing gets going, I wish the autism thing would get going a little more. I don't know why it's not catching on.
This is incredible. So if they are not the lucky 75%, they happen to be part of the 25% you mentioned. Does that affect how you're treating them, or what happens after they get the results?
See, they're the people who end up having higher inflammatory response. So they're
Mhm.
having more mitochondrial damage. So they're making more reactive oxygen species,
Mm.
which is destroying more plasmalogens.
Ah, so it's actually worse.
Right. So
Oh, wow.
Bredesen, have you ever heard of Dale Bredesen?
Yes, the Bredesen protocol. Yeah.
Right. He's America's leading guru. He's on public television all the time. He's like
Yes. For
every step
Alzheimer's. Yeah.
for Alzheimer's.
Yes.
When his book came out 8 years ago, he gave one paragraph to Shoemaker. Now, in his certification course, he has a third of his lectures in a certification course about treatment of mold because he says 40% of people who are getting Alzheimer's are getting it because they have accelerated inflammation from mold. He says there's 5 pathways into Alzheimer's. There's concussions, there's inflammation, there's diabetes. Diabetes is probably number one. There's poor building blocks, nutritional stuff, and hormones. And what was the last one? I'm off the back. But the chronic inflammation, I think, is probably 30-40% of people who get Alzheimer's. They have chronic unaddressed inflammation from their mold, from their sensitivity to mold. They have SIRS. They have
Mhm.
chronic inflammatory response syndrome with
Mhm.
SIRS. And that makes them more vulnerable. And they feel, I mean, when you find those people, they've had brain fog for years.
Mm.
Well, brain fog is one step on the way to developing Alzheimer's. Your brain isn't working. You're having trouble thinking. Your brain isn't, the computer isn't working.
Yeah.
And I think that manifestation is I said the simplest way of thinking of what's happening with your brain fog is your teenager is underneath your desk in your office with a candle, and he's melting the insulation off of your computer cable. And your computer keeps saying, delivery, not connecting to the internet, not connecting to the internet, or something. You're damaging the cables in your brain, and you need the building supplies to repair it. And what seems to resonate with people is I say, this is the word tool I've been using with them, as I say, I show them a picture of oligodendrocytes, and I say, see how that oligodendrocyte has, if you type up Google Images and look at an oligodendrocyte,
I'm looking.
and I say, see how that cell there uses extensions of its own body to make a membrane and wrap it around a nerve. So each oligodendrocyte is
Right here.
responsible for, right, there you go.
Yeah.
So each oligodendrocyte sends out some of its own membrane and wraps around 30 different segments of the nerves around it.
Hmm.
And the number crunchers, if every cell in your body has to take care of its own skin, just like you have to take care of your skin. You have to take a bath every day and wash off and clean off and make sure smell sweet and pretty when you go out in public. The oligodendrocyte is the only cell in the human body that has to take care of its own skin, and then those 30 segments have a surface area of 10,000 times its own surface area. So the oligodendrocyte has to take care of 10,000 times its own surface area. So when you have oxidative stress going on in your body and you're damaging plasmalogens, the oligodendrocyte has to repair the damaged myelin because it's trying to take care of 10,000 times its normal surface area. And in the last 100 years, our modern industrial world has developed a chemosphere. I use the word chemosphere of chemicals that are all slightly damaging. And
Ah,
it sort of raised the threshold at which we get injury earlier. So we're getting autism more frequently. We're getting many, many, many autoimmune diseases more frequently. We're having many, many new illnesses that are mysterious to us
mm.
because, but most disconcerting is all these brain diseases because our oligodendrocytes can't keep up. They can't repair themselves. And how did evolution allow ourselves to back us into that corner where we were so vulnerable? Well, evolution never knew we were going to develop atrazine and spray it on all our fields, or never thought we were going to develop all the chemicals we put in our food,
Food.
each of which has modest deniability. Oh, yeah, that one thing doesn't hurt that much. You can have carrageenan in your ice cream. That's not that big a deal.
Ah,
Until you do research on lab rats and find out that carrageenan is the standard method of making inflammation in rats. Well, we put it in all our ice cream to make it creamy. We're all eating carrageenan every day when we eat ice cream.
wow.
Oh my gosh, what are we doing that for? We're doing that all the time, but it's our brains with the oligodendrocytes that can't keep up.
Mm.
Those oligodendrocytes are really important cells for people to learn about. That's a whole that's a word tool topic that they have to get their heads wrapped around because that's what's happening in autism. But autism is damage to somebody who's only got 3 or 4 layers of myelin.
Yeah. Yeah.
Multiple sclerosis is somebody who already has 100 layers. Well, it's the same disease. It's just an older brain.
Mm.
And ADHD is also the same disease, just an older brain, so it manifests a little differently.
Hmm.
I just saw a lady yesterday who came to see me because she was so anxious, and I've never been anxious before until 5 years ago. Well, it's clear she moved into a new apartment. It was an older building in Wauwatosa. It's an old neighborhood. She got into a moldy house. And so I type in MRI brain diffusion defect anxiety. Type it in onto your computer right now. Type in MRI brain diffusion defect anxiety. And you'll get AI will first of all say, oh yeah, there's more diffusion defects. And I say diffusion defects is just a funny way of saying there's more water where there shouldn't be.
Uh-huh.
And that means you're damaging plasmalogens.
Mm.
Right.
Absolutely.
Well, so she's starting on 10 pill prodrome V and prodrome neuro as we speak.
Wow. So, Doc, you just start them right away on 10.
No, I start on 2 and I build up.
Oh, work it up, work it up. Yeah, yeah, yeah.
But what my guess is that I say you have to be on at least 50 milligrams per kilo per day to get some effective. If you're able to afford 100 milligrams per kilo per day, you'll get better faster. So almost every mental health diagnosis, you can take depression, anxiety, schizophrenia. I mean, type in MRI brain schizophrenia, diffusion defect. You'll see schizophrenia's got diffusion defects all over the place.
Wow.
Just different parts of the brain.
Different parts. That makes sense.
So you can take every mental health defect. You can take children with autism. You can take every child with ADHD. You can take every autoimmune disease. You can take coronary artery disease. You can take cancer. I'm having a hard time finding where plasmalogens don't fit.
Are you giving every single one of your patients plasmalogens?
No,
Hmm.
I have a whole bunch of 50-year-old women who come to me and say, I'm having so many hot flashes that I'm going to die. I've got to be on oxygen. And they are determined and they know exactly what they want. There's a few doctors in Milwaukee who are doing hormones. And I say, nope. I say, it, you know, if there's other issues, but I do write an email every week that I send to all my clients. And if you want, I'll be happy to send my email to you. You can, I've
I'd love
good
to
now
see it.
told a couple of the people in the PR folks at Good Now that we happy to if you use my email if he wants. My email was the #1 hit on the website at Aurora Healthcare when I was at Aurora Healthcare, and I've been writing it for 15 years. I put everybody on my email list, and they read. I say your job is to read my email every week
Mm-hmm.
and learn from it. And I'll write and as you learn from it, you'll learn how to keep yourself well and how this is the whole field of functional medicine. If you want to look up newsinnutrition.com, you can find the website and see the archives about it. But so I write this email every week and send it out to all my clients. And that also keeps feeding them information about plasmalogens and oxidative stress, which is what we're all in trouble from.
Mm-hmm.
Is that enough information? Is that what you're looking for from today?
Well, I was just curious to see kind of you're one of the few, really the only doctor that we know that has swapped their practice in this way. Um, do you remember what year you swapped it?
Well, I'm the
Good
guy
math.
that was when Goodenow was introduced to the world by Bredesen.
Yeah.
I'm the guy that clicked on the website to watch it just because I was bored one day and I just clicked on the website and I see this camera go on and I see these two guys sitting on the stage talking to each other and they both look at the camera and they say, "Oh, we've got a viewer. I guess we should get started." So I was there on day one that Goodnow got
Oh
introduced by
my
Bredesen by
gosh.
chance, just by chance.
Oh my gosh.
And Bredesen, of course, is making his podcast for his library, assuming that more people will watch it in the future. So, he's making. So I was there. I was a pretty early adopter.
Oh wow.
So I've seen his website go through about 4 different iterations. And I've been certified by him about 3 different times as he kind of developed his,
Yeah,
certification stuff.
sure.
And so, yeah, so but it's only been 4 years.
Yeah, yeah.
So, my first year I was only taking 2 pills a day, and I was quite irate when after 9 months, 2 pills of Glia and 2 pills of Neuro
Mm,
didn't help anything.
yes.
But that was the learning journey. We were all on a learning journey. We were sort of having to understand what it takes and what is it dangerous. And I only started getting a little risk averse. I wasn't risk averse. I'm not worried about it anymore. I've I got much more comfortable probably in the last 12 months.
It sounds like it. It sounds like you have such a good grasp of exactly what the solution is and how much they have to take, which is refreshing. I think more people need to hear it. They need to know that it does take a lot. And what about healthy people, just like me, where we don't have a particular disease? Would you still recommend like a more of a higher dose? And I know this is just all.
No, I say to Karen Kings, I say, Karen, you probably have a 20-year runway of safety in front of you. And right now, the smart thing to do is to be on B vitamins, extra B vitamins,
Yeah.
and possibly to do a couple blood tests to assess your risk. So you might want to get an HLA to see if
Uh-huh.
you're somebody who's just more risk for that.
Uh-huh.
If you have extra money, want to do a DNA test, that costs $1,500, so you may not want to do that. But if you get pregnant, you have to be on plasmalogens.
Yeah.
That's when you have, because the only way we're gonna beat this autism thing is around pregnancy. And I think the only way to break up this whole fear of vaccination is to then say everybody getting vaccinated should be on prodrome glia for 2 weeks prior to the vaccine.
Mm.
That's what I'm telling people. You should be on prodrome glia for 2 weeks prior to the vaccine.
Wow.
Then
That
you
is
won't have any
refreshing.
side effects. You won't have to worry about side effects. You won't have to worry about being tipped into this is my graphic that I show people. This is in the book, the autism book.
Uh-huh.
That's the graphic that's in the autism book.
Wow.
And it's basically walking people through how a baby gets started at life, and then bit by bit they get more and more and more oxidizing stress. And they don't realize it, but those RSV infections and vaccinations have gotten them down to 12%, and 10% is the threshold to get autism. And they get one more vaccine, and poof, that knocks them into.
Uh,
But if you do the epidemiology of it and actually do the credible science, the vaccine isn't what was causing it. It's all the other causes of oxidative stress. The problem is we can't clean up all of them. Society is. It is what it is. We have rubber tires. We have
yeah, yeah.
fields with fertilizer on them. We
Can't
have
escape it.
chemicals around us.
Mm-hmm.
So you can't fix all that, but what we can do is make you safer.
That's beautiful. That is
So
exactly,
you've got a long runway of safety ahead of you. So keep exercising, keep
yes.
controlling your weight, keep
Yeah.
taking your vitamin D and vitamin K2,
Yeah.
and and you're probably in a pretty good spot for another 20 years. But if you start having any kind of mental health issues, any kind of cognitive function, any kind of autoimmune disease, let's have a conversation because we can nip all those things in the bud.
Wow.
You know,
That's incredible.
and and we should follow Bredesen's other admonitions for keeping you healthy. So when you become menopausal, you should be on hormones.
Mm-hmm. Mm-hmm.
You know, those should be replaced, just like zinc and copper should be replaced and measured. See, I'm a little distressed that there's all these zinc pills and just blindly without measuring zinc and copper. I think we should be measuring zinc and copper in everybody.
Ah,
So I do in my practice. I
yeah.
measure people's zinc and copper all the time.
Ah,
And that's one of Bredesen's key measurement issues. And, such I do Bredesen's lab test as kind of a background lab test because those are well documented and there's good published literature for those standard blood tests. And that's just my background stuff.
oh, Dr. Whitcomb, thank you so much for taking an hour of your time to enlighten us with how it is that you're using this and why you're using plasmalogen so much in your practice. And it is, I just love the refreshing take on your approach. It is not something I've heard quite often. I think it is very particular to you. And we've received a lot of physicians from you, your friends who have come to us because you're telling them that you're doing things this way. So I want to thank you, number one. And then thank you, number two, again, for taking so much time to explain this to me because what you're saying is so critically important. And I think it's very compelling. So I hope you have a wonderful time in Switzerland. Talk
If
and keep
if
us posted on how I know your
if
daughter-in-law
I can,
wants
if I
to
can,
keep
I'll bring you back
too.
a black. I'll bring you
Oh
back a
my
black nose
gosh, I
sheep.
want one. Oh my gosh.
I
Thank
just don't
you
know
so
if you're
much.
allowed to take it on the airplane.
Just sneak him in. They seem like very quiet little beings.
All right, talk to you later.
Thank you, Dr. John.
Bye.
Bye.